of people want to know, they've been told that they have dry eyes and they aren't quite clear about what that is, because a lot of times people with dry eyes will have watery eyes and the doctor says, you have dry eyes, and the patient says, doc, you're crazy, my eyes are watering all the time. And so let me explain a little bit of what's going on. So inside the eye here is where this becomes dry. And what happens is sometimes it becomes irritated. And if it becomes irritated because it's dry, the body says, oh, there's something wrong. Let's flush it out. There's something in my eye. Let's flush it out. And tears are made and they come in here to clean out anything that might be going on. And so you get these excess tears. Now the body makes different types of tears. It makes normal lubricating tears that are supposed to be there. But when it thinks there's something wrong, it makes flushing out tears. And those tears are not as comforting. So you may have a lot of water in your eyes, but they're not very comfortable. And so that's part of what an aspect of dry eye is. There are two parts to the tear film, two main parts. The first part is the liquidy stuff that we think of as tears. That's made by the lacrimal gland right here. So the watery stuff is made by the lacrimal gland. It comes in here, kind of cleans out the eye and keeps it moist, and then drains out these little puncta here. And that's where it gets cleaned out. So it gets cleaned and then it kind of drains out these little holes. There's another part that we've learned is just as important, and that is made at the base of your eyelashes. We have these oil glands. These oil glands produce oil to go inside the eye to lock in the moisture. And in fact, especially as we get older, we find that's a bigger factor of dry eye. It's the fact not that we're not making enough tears, it's that we're not getting enough oil. What happens is these oil glands get clogged and they move slower and the oil just doesn't move like it used to. So that's one of those two aspects are how we treat dry eyes. There are medications that address the lacrimal gland to encourage it to produce more tears. And we also have drops that increase the oil inside the eye. There are other things that we recommend. We recommend lid scrubs to keep the dead skin off of here and sort of stimulate these oil glands to move oil like it's supposed to. And artificial tears just to moisten the eye. We also have a machine called a LipiFlow. What the LipiFlow will do is it will sort of warm up these oil glands and kind of gently massage it. What that does is sort of like a deep clean. It gets out this old gunky oil that's been stuck in here, and it helps unclog this for the oil to move the way it's supposed to. So we do have a LipiFlow machine that we can use to do a deep clean, and it helps stimulate these oil glands to move a little better and help produce the oil like it's supposed to.